Hello, dear listeners. Welcome to Landing America podcast. On today's episode, I invited Lorena Tomasini. She is a health insurance broker. She's been in the business for 18 years. And since health insurance is a topic that many of us don't have too much information about, I decided that it will be a great idea for her to bring a little bit of knowledge and awareness. Welcome, Lorena.
Thank you so much for having me on. I know it's a very confusing topic, especially for people coming from other countries that might be used to having health insurance a different way than how we do it here. So happy to provide education.
So, Lorena, tell us, how does health insurance work in the United States?
Sure. So health insurance, the actual definition is transferring risk from yourself to the insurance company. And really, what we're doing is transferring the risk of having a medical emergency or needing to go see a doctor from your pocket to them. So that way, the insurance company covers most of it. And yeah, you still pay part of it, but the majority of the risk is the insurance company's responsibility. So here it works a little bit different because I know from other clients that I have, they tell me, oh, I pay for my insurance and that's it. I can go see a doctor, do a surgery, and I don't pay for anything, right? Here it's a little bit different. You pay a monthly premium or if you want to pay annually. And then if you go see a doctor, you might pay a fee to go see a doctor. Usually labs for the annual checkup is included in the plans. But if you need to do other labs or if you need to do an x-ray, you do pay part of that and the other part the insurance company. And I'm sure we'll get into more detail about deductibles and co-pays and out-of-pockets and all these terms that can seem confusing, but hopefully after listening or watching the podcast, you'll leave with a better understanding for when you buy insurance.
What steps should individual take when choosing an insurance and what questions should they ask?
Yeah, so there's a few steps you need to take. One is, where are you buying insurance from? Are you buying it from an insurance broker like myself? So a broker means that I represent multiple companies to find solutions for the consumer based on their needs, their budget, maybe if they have specific doctors or medications that they take. So that's part of our job, is not just here, take this company. It's why are we telling you these two or three companies might be a good fit, right? So some questions that consumers can ask when they're first looking at who to buy insurance from is, do you just represent one company or do you represent multiple companies? That's important. Second, I always say to work with a local broker. So that means somebody that lives in your area, because the plans vary based on where you live. So plans, for example, in Miami-Dade County are not the same in Broward or Palm Beach. They might look similar, but there might be differences. Like if you live in Broward, maybe you want specific hospitals, right? And so questions that consumers can ask are things like, do I need a referral to see a specialist? Are specific hospitals that maybe you want to have in network? Make a list of what hospitals maybe you've heard from a friend or family member that are important to have, right? And then also ask, of course, about deductibles and out of pockets. How does the plan work? So that you really understand, and make sure to ask them for examples. Like, okay, you're telling me my deductible is so much and my out of pocket is this amount. What happens if I go to the hospital? How much do I pay? So that way you have like a real world scenario of how the insurance will work.
What does deductible mean?
I knew that question was coming. So let's back up a little bit, right? So we have something called a copay. So a copay is what you pay when you go see a doctor, for example. And that's a fixed amount, like $10, $20. And so you can see what that is. You should also ask for a summary of benefits. That's just like a list of, with this plan, if I go see a doctor, this is how much I'll pay, right? Because sometimes in a phone call, you'll forget what we tell you, right? So at least you have something in writing. A copay is at a fixed amount. to go see a doctor, to go for an x-ray, for certain things, right? And then your deductible is like in a car insurance. If you crash your car, you pay the deductible, and then the other part, the insurance for cars. For humans, it's pretty similar, right? So the deductible would be, let's say you have a deductible of $5,000. What that means is that for certain things like an MRI or a hospital stay, so something major, right? You would be responsible for the first $5,000, and then after that, the insurance company starts paying. So it's basically what you're responsible first before the insurance company pays. But it's really for major things, not for like a doctor visit or labs, unless it says it, but for the most part, okay? And then your out of pocket, that's really the most important number. It's called maximum out of pocket, and that's the most you'll pay a year between everything. So between the copays and your deductible, the most you'll pay is your maximum out of pocket. As an example, let's say it's 7,000. That's the most you'll pay between everything. Okay.
And that's regardless of what happens to you.
Correct. Whether it be something catastrophic like heart attack, cancer, whatever, an accident, right? Food poisoning, whatever it might be, that's the most you'll pay. It doesn't mean that you have to pay that amount. It's just going back to insurance is protecting your pocket. You're protecting your pocket that you won't spend more than that for medical services in a year.
If I understand it right, there is deductible, copay, and out of pocket.
Mm-hmm.
Every insurance includes these three, or do you pick insurance with either one of them?
No, so that's good. All insurances have a copay, deductible, and out of pockets. Some plans, depending maybe on the person's income, for a deductible might say zero because their plan has no deductible, right?
Mm-hmm.
But yes, all three factors have to be in the plan. Hmm.
When deductible is zero, that means you pay zero, everything is covered.
That's a good question. No, you still, that just means that the insurance company is already paying for you. So you don't have to meet your deductible before they pay. So for example, in the MRI, it'll say just $100 as an example. It would probably be more, but let's just use $100. So since you have no deductible, then you just pay your copay of $100 because the insurance company is covering the rest for the MRI.
Okay, so when I'm choosing my insurance, I have to look at how much the copay is, which will be the amount I pay every time I go to the doctor,
Mm-hmm.
for example.
Yes.
And then the deductible is when there is, let's say, a surgery or something that is a higher amount,
Mm-hmm.
and I have to cover the amount up to what my deductible is.
You got it.
And then out of pocket is in like big
Between everything.
instant between
Between
everything per
everything
year.
per year. Yeah.
Mm.
It's not that you have to meet your out of pocket.
Mm-hmm.
It's just peace of
Better
mind.
not.
Yeah. It's just peace of mind that if something major does happen, well, I know the most I'll spend from my pocket is X amount. Now, the insurance company, so the Affordable Care Act, or what people like to call Obamacare, it's health insurance, okay? And that changed a lot of how insurance works in the United States, which is good for consumers. So, insurance companies have no limit on what they can spend. So, if somebody is, having something major like cancer, right? Because that's a lot of treatments and stuff. If the insurance company is spending $100 million a year and that person, their out of pocket was only 7,000, the person only paid 7,000 and the rest the insurance company is paying for. Why is that important? Because before the Affordable Care Act, insurance companies could say, "Oh, the most we'll pay is 2 million a year." Well, if you're going through something catastrophic, 2 million a year in a hospital is quick. That'll be like in a week or two, right? So that's really good for protection for consumers. Hmm.
What if you don't have health insurance?
Yeah, so, the number one reason why people go into bankruptcy is because they don't have health insurance. And it's one of the major reasons why they did the Affordable Care Act, because before Insurance companies could deny you if you had a what we call a pre-existing condition, like high blood pressure, diabetes, maybe your height and weight was not in this chart, right? So a little bit overweight, or something that happened years ago, you broke your shoulder, right? So insurance companies could say before the Affordable Care Act, we're not going to take you, or you need to pay more for us to cover that pre-existing condition. So part of what the Affordable Care Act did is that it removed that barrier. So you could be somebody really sick and you'll still have coverage to cover whatever you need. And the other aspect of why people did not have health insurance is it costs too much, right? So health insurance before was just based on your age. The younger you were, the more affordable. The older, the more expensive. So now to not have health insurance, it might not make sense financially because a lot of consumers do qualify for tax credits to help them pay for their monthly premium. So that's going to be based on their family size and their expected income. But yeah, if you don't have health insurance, yes, you can still go to the hospital and you'll be, of course, taken care of, but then you're responsible for 100% of that bill. And, the number one reason why people go to the hospital is food poisoning, okay? Which sounds funny, but it's true. And then, if you go to the ER, that bill's not gonna be less than $6,000-7,000. So I would rather have health insurance and know that at least part of that is going to be covered by my health insurance. And yeah, I might have to pay some of that, but not all of it.
I had a question from one of our followers on Lending America podcast asking that what if I'm a healthy individual? I don't go to the doctor very often, almost ever.
Mm-hmm.
I paid maybe $700 max in the past 5 years just for the dentist once. Why should I get an insurance? Does it make sense? Because I believe in 5 years of paying for the insurance, this individual would pay much more money.
Again, that's going to depend on their family size and income.
Mm-hmm.
Because if they're lower income, maybe they just pay $10-20 a month.
Mm-hmm.
But if they're higher income and maybe they don't qualify for a tax credit, yeah, they're gonna pay the full cost of insurance, which might be minimum $350 a month,
Mm-hmm.
right? Depending again on their age. But it might make sense because again, you never know when something might happen. And okay, nothing's happened for the past 5 years, but the worst thing that could happen is something does happen and then you're worried about hospital bills instead of worrying about recovering, right? Again, it could be maybe somebody healthy, it could have been a car accident, and they think, oh, I have car insurance, that'll cover my hospital. No, that'll cover your car, but not the bills at the hospital, right? So again, it goes back to financial protection. And while, yes, if we look at it financially, like let's say I pay $300 a month for insurance, that's $3,600 a year, right? If my math is right, 36, yeah. 3,600 a year that I'm paying, and my out of pocket is, I don't know, $8,000. Well, if I really needed to use the insurance, my out of pocket would have been like 12, right? If we do the premium plus the out of pocket. But even then, you would still be saving money. Again, if you have that catastrophic instance. Now, what some people do is they'll tell me, no, I don't want to pay the $350 a month, but I need to have something in case I want to go see a doctor. Then you could buy like a discount plan, which is not health insurance, but it's just to go see the doctor, do labs, maybe go see a specialist if you needed to. Maybe you need some generic medications, right? And so you could do a discount plan, which is not health insurance. It's not going to cover everything, but at least you get discounts on things and it's not going to cost 300 something a month. That's like worst case scenario. If you have the funds, but you don't want to spend it. Another way of looking at insurance is tax savings, which that can be done with what's called a health savings account. And that's you buy a health insurance that includes a health savings account. And so you can put money into that savings account that's tax deferred and you deduct it from your taxes. That then, if you needed to, you have funds from where to get to cover a medical expense. But that's for people that, are looking to save on taxes as well.
And you said that depending on your income, you might pay 300 a month or $10 a month.
Mm-hmm.
Will the coverage be the same then?
Actually, the people that pay less a month have are covered more because their plans, like the one that I said that has no deductible, right? Their plans, if you, let's say you're single, as an example, and you make between 100 and 150% of the federal poverty level, it's a chart that we use of income. Those people qualify to not only get assistance in paying for the monthly premium, it's not assistance, it's a tax credit to help them pay for their health insurance. But the government also says, hey, they need help using the insurance because their income is not very high, right? So for them, they'll have no deductible, it'll cover 94% of their cost, which means that their out of pocket is very low, like 1,200 a year. To see the doctor is zero, specialists are maybe $10, right? So using it is very affordable. Now, if you're on the other spectrum, you make a lot of money, and that's great, but unfortunately, you're not going to qualify for that tax credit and you're paying the full cost of insurance. Then, in that case, we might look at a few options, right? We could still get a plan that has no deductible, so that way you're not having to come out of pocket for certain things and you know exactly how much you're going to pay for an MRI or for an x-ray, right? So you have fixed costs and then you still have a maximum out of pocket protecting you in case of needing something for something catastrophic. So that's a popular option for consumers that make more income and maybe don't qualify for a tax credit. And then the other one would be the health insurance with the health savings account for tax purposes.
What does health insurance have to cover?
Sure. So by law, there's certain minimum essential coverages that your health insurance have to cover. And these are both for individual and family plans. So what people call the marketplace or Obamacare, it's all the same thing, just different terminology, as well as group insurance. So if you have insurance through your job, okay? So they have to cover doctors, specialists, hospital, surgery, maternity, have to cover pre-existing conditions, which is really important. No limit on what they can spend, so on what the insurance company can spend. Mental health, which is very important. I think a lot of people after the pandemic, I see it often, are asking me more about, oh, does the plan cover mental health for psychiatry or I take anxiety medications, right? So that's really important that the plans do cover that. And what else? Surgery, if I didn't mention that. Another important thing is that all the plans, regardless of which one someone chooses, also has to cover preventive services. So what does that mean? That means for all adults, your yearly checkup. So that's like to cover, cholesterol screenings, high blood pressure, the urine analysis, right? That type of stuff. And for women, it also covers the gynecologist things, the pap smear, mammograms, okay, at no cost. And for men, it also includes like prostate exams.
Once you have the insurance, can you go to any doctor?
That's a good question. A lot of people say, I just want to go to any doctor. We all want to do certain things we can't do, right? Like, oh, I want to go see my friend's doctor in another state. That might be a little bit complicated, right? But no, usually insurance companies have a list. It's called a network. So these are the doctors that you can see. Okay? So sometimes they'll say, oh, you need a referral to go see a specialist, and that just means you need, like a doctor's note from your primary doctor that says, hey, yeah, this person needs to go see a cardiologist, for example.
Is there any specific insurance you should choose in case you're pregnant?
So all the plans cover maternity. That's really going to depend on an individual basis because some people already have an OBGYN that they want to keep. So in that case, we would look for which company does your OBGYN take, and that's how we would determine, okay, that's the one for you. And for others, it might even be like a hospital that they want to give birth at. So making sure that the hospital is included or in network with the plan.
Do they cover C-sections?
Yeah.
That's just a side question.
No, yeah, yeah, it's
um,
important. As you know, a lot of times people have questions like, will it cover if I want to do cosmetic surgery? No. But if you have a medical emergency, you went through the sliding door glass and now you need to operate your nose, that'll be covered because it's a medical emergency, not cosmetic.
so
Okay.
that's how you should do it
I didn't
if
say
you
that.
want.
I'm just saying how insurance companies look at things, right?
If you want a new nose, smash the door.
Right?
Can you share tips for saving money that will not compromise the coverage?
Sure. So, a few ways of saving money, it all depends on how you look at it. Some people say, I want a plan where I have no deductible, so that way I know exactly what I'm going to pay for everything. But that also costs a little bit more a month than I'm talking about for people that maybe don't qualify for the tax credit, right? But others say, I rather save money on my monthly premium and know that, okay, I have a high deductible, but I only go to the doctor once a year, so I'm not really planning on using the insurance. So those are two key things to look at when we're looking at saving money. Now, another way consumers could save money is maybe their prescriptions. You could look up like prescription discount cards because maybe it'll be more affordable than using your insurance for that. It just depends again on the plan that you have.
What are the most common mistakes people do when getting their insurance?
So, the most common one I see is when people call me and tell me, I just want the plan my friend has. My friend has this company. And I'm like, that's great. That might work for them, but that might not be the company for you. Going back to what are your needs? What's your budget? Do you have specific doctors, medications, right? So maybe for your friend, XYZ company might be a good fit, but not necessarily for you. So making sure that you're picking a plan based on your needs and not somebody else's. And then, sometimes I see people choose plans because it might cover something additional like dental or vision. Some plans, very few, include dental and vision in their plans, but sometimes you might be paying more for that than if you were to just get a plan separately.
Who is eligible to get the health insurance?
So there's a few requirements, right? So you have to be lawfully present in the United States. So what does that mean? You need to have like a temporary protection status, a green card, residency, so some legal status here, plus of course a social security number. And then the other part to health insurance is either working or depend on somebody that works to maybe see if you qualify for a tax credit, right? So it's important that if you're married, that you file taxes jointly because if you don't file them jointly, then even if you would have qualified for a tax credit, you won't be eligible for it. So that's really important. That's also a mistake I should have brought up that I see people make. They tell me, oh, I want to file separately. I'm like, but if you're married and I see here based on income, you do qualify for the tax credit, it's important to file jointly. So that's important. So immigration status is important. I see a lot of people telling me, "Oh, but I don't have a green card. I don't have my residency." Okay, but you have a work permit. So you're here legally and you have a social security. So you definitely qualify. Because a lot of people that come from other countries, they're worried about, they don't want to be what's called like a public charge to society because I think they can't. I'm not an immigration attorney, right? But it's important to note that this isn't an assistance, it's not help, it's a tax credit. So if you know that you will file taxes and you make enough to qualify for the tax credit and that you're here legally, then yes, you can buy insurance. Now, when you can buy health insurance is a different question.
So when can people buy? What is the time slot for getting the insurance?
Yeah, so usually what's called open enrollment, that means anybody can apply, anybody that qualifies can apply for health insurance or renew their plan. That's from November 1st until December 15th for January 1st effective dates, and then December 16th until January 15th for February. Now, what happens if we're in June and now I want to buy health insurance? Well, you need to have what's called a special enrollment, and that just basically means a life change. So, getting married in the past 60 days, having a baby in the past 60 days, moving from another country or another state here, gaining an eligible immigration status. So maybe somebody was working on their paperwork, as we say in Spanish, right? And now they have that green card or that work permit, right? So now they can apply because that's a life change, okay? And then a one that's open all year round is for individuals that are lower income. So those that make between 100 and 150% of the federal poverty level, they can apply any time of the year.
What if someone misses this deadline?
Yeah, so yeah, if you miss the deadline to apply for health insurance, you can only apply if you have, again, a special enrollment. So in those cases, we can look at getting like a discount plan to at least hold you over until November.
What about international coverage? Is there any insurance I could buy that would cover me if I go to Europe?
hmm So there's something called travel insurance. And so what that does is it helps cover any costs if you needed to for a medical emergency outside of the US. Some people buy it actually when they're coming into the US, like they're going to visit for a few months. That's going to depend what country you're coming from. But let's say if you're going to Europe as an example, and you know, okay, I'm going to be gone from June 1st until August 18th, right? Whatever date might be. Then you would buy the travel insurance before leaving the US to help cover that trip. So if you have a surgery, an accident, right? That plan would help cover that cost.
Will you have to pay it first out of pocket?
That's going to depend on the policy. Most you might need to pay out of pocket and then bring the receipts and send it to the insurance company. Some might say, okay, we'll cover up to this amount. So that all depends on the plan.
Thank you so much, Lorena, for sharing all this valuable information. How can people find you?
Sure. So on social media, you can find me through my company MALMINS 22. That's Instagram, Facebook, and then TikTok. I have LORESINI. The same things we post on Instagram, we'll put it on TikTok. So
I
yeah.
will attach your handle into the
Sure.
description. Thank you so much. Thank you for listening or watching. If you like this episode, hit the like button. If you have any questions, feel free to reach out to us or leave a comment. Thank you, Lorena.
Thank you so much for having me.
It was a pleasure.